Hello, everybody. This is Dr. Kamel again, and a new content related to physical therapy education and um, examination preparation. I mean, especially the preparation for the BT license exams for those who are interested in the US exam or the Canadian exam or the Australian exam. If you didn't see any of my videos before, my name is Dr. Kamel. I work as Associate Professor of Physical Therapy in the United States, and I am a registered licensed physical therapist in the United States, in the UK, and Egypt as well. I got my PhD from University of Nottingham in the UK. So let's go ahead and see what is today's content is about. A physical therapist is preparing to evaluate a patient who had a closed reduction with cast fixation for an ankle fracture 1 day ago. Recent fracture of the ankle, and the patient had a closed reduction with cast fixation. So there is no open reduction, nothing, no nails, nothing like that. It is still closed reduction and currently has non-weight bearing status. So the surgeon or the orthopedist who did this closed reduction give a physician order for non-weight bearing status. So the patient should not put any weight on this limb after as you can see, the fracture is very recent. The patient reports foot pain in the injured extremity. It might be, you know, as something common, or it might be something serious. Based on the patient's report, patient now is complaining about pain in the injured extremity. Which of the following procedures should the physical therapist perform? Here, I would like to differentiate. Is this something related to the fracture itself and it will go away? Or it might be that this cast is too tight. There is hindering of circulation, and we are dealing with ischemic situation, which will propagate to a very serious situation like gangrene, amputation, stuff like that. We need to know what's going on. So the physical therapist should do what next? We need to do some screening to make sure that the patient is okay. Because if the patient is in need to be referred to the ER or back to physician, whatever, we need to do that as soon as possible. So the physical therapist can do gait examination. Do you think this would help? I don't think so. The patient is already non-weight bearing on this limb. Transfer abilities. What do we mean by transfer? Transfer like sit to stand, spine to sitting, stuff. Will this add any information? I don't think so. Capillary refill in toes. We use this test actually, and I teach that in my cardiopulmonary course in order to see if there is any compromised circulation and if there is actually, the cast is very tight, compromising the blood supply going distally. We might see that we have a problem with this test with the capillary refill in toes. So it might be the answer. Blood pressure examination for what? What the blood pressure examination will give us? Systolic over diastolic. What will be the difference? Okay, so the correct answer is capillary refill in toes. Patient, let's break down, to understand why we have selected this. Let's break down the information here. The patient is day one post closed reduction with cast fixation and reports foot pain. Okay, this is early after casting. The cast is just 1 day ago. So because some people they might have itching, they might feel that the cast is giving them some discomfort. But no, this is very recent, 1 day ago. So vascular compromise could be a something, could be a priority, and we with this increased pain, we might see or might think that there will be excessive swelling, the cast is too tight, there is impaired circulation, and then what could happen? Compartment syndrome, which is a surgical emergency or medical emergency, which is actually increasing pressure within the lower leg, you know. So capillary refill test assess the peripheral circulation. If it is a quick test, non-invasive, easy test, and essential after casting to make sure that the blood circulation is okay, either arterial and venous, both ways. It is mainly concerned with, actually mainly with the arterial, helps determine if the cast is too tight or if the perfusion is compromised. Means that there is no enough blood supply going distally. So always neurovascular status is a priority, because if there is a compression on the blood supply and it is not resolved, what will happen? Ischemia, gangrene, amputation. If there is a compression on the neural structure, what will happen? Atrophy, paralysis, or something like that. So this is a priority. So again, patient in this question is non-weight bearing. So transferability is gait examination, less likely to give us any information. And since the patient is non-weight bearing, so why we would expect these activities to cause any foot pain? So the only option is capillary refill in toes. We know that sometimes one of the complication of cast fixation could be swelling, and if it is severe enough, will lead to compartment syndrome. So we need to make sure that the blood is going distally well and the distal blood flow is okay. Okay. So it is an easy test, as I told you. Also, checking blood pressure, uh, you know, uh, yes, it might affect the perfusion or the amount of blood going to the distal extremities, but we cannot actually test blood pressure from lower extremity in this situation with the cast on. The cast is hard and tight. So we will not be able to test the blood pressure from lower extremity in this situation, you know. So again, the incorrect answers. Gait examination, patient is already non-weight bearing. Okay. And later on, yes, we can do gait training using assistive device like crutches, auxiliary crutches, for example, in order to continue the status of non-weight bearing and gradually take the patient to weight bearing isolated, partial weight bearing, full weight bearing. It will take time, okay, but it is not addressing the main issue for this patient who is just 1 day post fracture. Okay. Transferabilities, yeah, is important that we test the patient functional ability and functional independence, but it will not cause such pain or foot pain. Okay. Blood pressure examination um, will not explain. Yes, it is important to check vitals. Some people they said, okay, check vitals from upper extremity. Okay, then what information you will get from that? And we cannot assess blood pressure from lower extremity due to the cast related complications. Okay, so it is non-specific actually. So after what is the main point to take home? After fracture reduction and casting, new or increasing pain is an alarming situation. We need to assess circulation first. We need to give priority to the neurovascular band or and do neurovascular checks, checking color, Any changing colors, nose is pallor, anything, temperature, is a skin is cold, capillary field test, an easy test, sensation testing, if there is numbness, if there is paresthesia, loss of sensation, pain, and this is always coming before testing mobility or functional testing. This was today's hint or today's content. If you would like to join my BT license exam preparation course, which is a comprehensive course actually, and we have a wide range of students ranging from new grads until those who are in their 40s and 50s and they are preparing to take the exam. And I have actually some physical therapists who are taking the course for, um, clinically applied experience to improve their physical therapy education and physical therapy experience as we explore all aspects related mostly or all branches related to physical therapy so it give them a good clinical experience. If you'd like to apply and join the transitional Doctor of Physical Therapy program at University of Montana, which is an online study program, the enrollment is open till beginning of April 2026 for the coming semester. So please send me a message on WhatsApp numbers 001442248720 or 00201027743702 and I will give you all the details and requirements for either the course or the DBT program. Thanks for watching me. Thanks for listening. Thanks for encouraging me by your very nice comments and very nice messages. Please subscribe to the channel if you didn't do so and encourage your colleagues to subscribe and join either students, physical therapy students, or physical therapy graduates. Thank you.